If you
Welcome.
frequently wake up in the
Today,
middle of
we're
the night
discussing
with
the
cold feet,
importance of regular
experience a
checkups.
dull cramping ache in your
Understanding your
calves
health
after
is
walking
crucial.
short distances, or notice that your lower legs look pale or slightly discolored, you must
Oh,
take
my
these
aching
biological
feet.
warnings seriously. Poor lower extremity circulation
Why
is
does it
not a
have to
minor
be this
cosmetic
way?
inconvenience of growing older. It is a serious cardiovascular red flag indicating that your peripheral arteries and venous valves are struggling to push oxygenated blood through your leg tissues. As we navigate past the age of 60, arterial walls naturally stiffen
Elderly calf
and
muscle
accumulate
tissue,
microscopic
cellular
fatty
hypoxia,
plaques,
restricted blood
narrowing
flow,
the vascular
oxygen
lumen
depletion,
and drastically
genmicroxia,
reducing
ischemia.
microvascular blood flow to your calves, ankles, and feet. When your lower leg muscle fibers are starved of continuous arterial blood, they enter a metabolic state of cellular hypoxia, triggering chronic muscle fatigue, slow wound healing, and accelerated
The risk
muscle
is
tissue
significant.
loss.
These
Even
blockages
worse,
need
when your
immediate
calf muscle
attention.
pumps
Otherwise,
remain
the
inactive due to
consequences
prolonged
could be
sitting,
severe.
deoxygenated blood pools in your lower leg veins, elevating venous pressure and causing fluid
impact of
leakage,
vascular
ankle
restriction on
swelling,
joint and tendon
and
health.
painful varicose vein
Restricted blood flow
formation.
causes knee
Tragically,
cartilage ischemia.
millions of aging adults completely ignore these subtle circulatory warnings, misinterpreting leg heaviness as simple muscle fatigue, unknowingly allowing vascular blockages to deepen day after day. Ignoring chronic poor circulation accelerates microvascular nerve damage, weakens your Achilles tendons, and deprives your articular knee cartilage of essential hydration and nutrients, drastically increasing your fall risk. What if vascular surgery science proved that you can accurately assess your leg blood flow right now in just 30 seconds, and then flush oxygenated blood into your legs using 5 targeted fast-fix exercises? In this clinical guide, Dr. Robbert will reveal a simple 30-second capillary refill and skin color circulation test that you can perform immediately from your chair to evaluate your peripheral vascular health. Following this diagnostic test, you will learn 5 surgical-grade exercises specifically engineered to activate your deep calf muscle pump and stimulate immediate endothelial nitric oxide release. By engaging these mechanical muscle pumps, you force stagnant venous fluid back up toward your heart while pulling a surge of warm, oxygen-rich arterial blood down into your toes and feet. This dramatic surge in lower extremity microcirculation instantly relieves leg heaviness, quells nocturnal calf cramping, and accelerates cellular repair throughout your lower body muscles and joint capsules. You do not have to accept cold feet, swollen ankles, or painful leg cramps as an unavoidable price of getting older, nor do you need complex
feels
athletic
good.
equipment to restore vibrant vascular flow.
Morning.
Your vascular system retains a remarkable lifelong biological capacity for angiogenesis and endothelial dilation, allowing your blood vessels to expand and improve circulation regardless of your age. In this comprehensive medical breakdown, Dr. Robbert will guide you step by step through the 30-second vascular test and demonstrate all 5 fast-fix circulation exercises. These gentle movements require no athletic machinery, take less than 10 minutes to perform, and can be easily completed while sitting comfortably in your living room chair. By incorporating this simple vascular protocol into your daily routine, you can safeguard your peripheral blood vessels, eliminate leg heaviness, and protect your physical independence. Before we demonstrate the 30-second circulation test together, let us examine the internal vascular biomechanics of how blood flows through your lower extremity arteries and veins. Let us look closely at your leg vascular anatomy, venous valves, and blood vessels to understand precisely why calf muscle activation is the ultimate key to vascular longevity. Sit back comfortably, take a deep breath, and prepare to discover the transformative vascular secrets that will revitalize your leg circulation and protect your health for years to come. To understand why peripheral leg circulation deteriorates after 60, we must examine the physical forces required to pump blood against gravity from your big toe back up to your heart. Your arterial system relies on heart contractions to drive oxygen-rich blood down into your lower extremities.
Welcome.
But returning
Today, we're gonna do a
deoxygenated
simple
blood back
30-second
upward
test to
requires
check your
the
balance
dynamic
and mobility.
contraction of your
Ready?
calf muscles.
Start.
When you sit for extended hours, Your deep gastrocnemius and soleus muscles remain
Notice the
completely still,
resistance here.
causing blood to
Apply
pool in your lower
gentle,
leg
steady
veins and
pressure with your
creating high
thumb,
venous pressure.
feeling for any
This chronic
tenderness.
pressure damages fragile venous valves, allowing fluid to leak into surrounding muscle tissue, resulting in swollen ankles, cold feet, and tight, heavy lower legs. Before starting any exercise routine, you must perform our simple 30-second home vascular test to evaluate your current peripheral capillary refill and arterial blood flow. To perform step 1 of the test, sit comfortably, lift your right foot, and press your thumb firmly against the top center of your foot or big toe pad for 5 full seconds. When you release thumb pressure, notice how long it takes for your blanched white skin to return to its natural pink blood color under normal lighting. A healthy capillary refill time takes less than 2 seconds. If your skin remains pale or white for 3 seconds or longer, your microvascular capillary beds are experiencing restricted arterial blood flow. For step 2 of the test, elevate both legs onto a chair or cushion above hip level while lying down for 20 seconds, observing the color of your foot soles. If your soles turn abnormally pale while elevated and then turn dark red or purple when placed flat on the floor, you are displaying classic clinical signs of impaired peripheral arterial perfusion. Now that you have assessed your baseline circulation, let us initiate our 5 fast fix exercises designed to instantly flush warm, oxygenated blood through your lower extremities. Exercise 1 is the seated calf pump elevation with toe pointing, engineered specifically to engage your deep venous muscle pump. Sit upright in your chair. Extend both legs forward. Elevate your feet 2 inches off the floor, and forcefully point your toes forward away from your body for 2 seconds. Next, pull your toes firmly back toward your shins as far as possible, holding the backward stretch for 2 full seconds, while feeling your calf muscles tighten intensely. Repeat this rhythmic toe-pointing and flexing motion continuously for 30 seconds to squeeze stagnant blood out of your calf veins and pump it upward. This mechanical pumping action immediately lowers venous pressure in your ankles, reduces tissue swelling, and pulls fresh arterial blood down into your feet. The second fast fix movement is the seated ankle alphabet, with microvascular circulation activation. While keeping your leg extended, draw large capital letters in the air with your big toe, moving your ankle through its full anatomical range of motion from letter A to letter Z. This multi-directional ankle movement activates your tibialis anterior and peroneal muscles, wringing out congested blood vessels and promoting microvascular dilation. Let us now prepare to explore exercise 3, designed to release tight popliteal arteries behind your knees and restore rich blood flow to your feet. Exercise 3 in our orthopedic circulation protocol is the seated popliteal artery decompression stretch, designed to release trapped blood vessels behind your knee joint. Prolonged sitting with knees bent at sharp angles creates mechanical compression on the popliteal artery, restricting oxygenated arterial blood from reaching your lower calf muscles and feet. By executing a gentle, unweighted leg extension combined with an upright spine tilt, you relieve mechanical tension behind the knee capsule, immediately opening up arterial blood flow down your lower leg. To perform exercise 3, sit near the front edge of your chair, extend your right leg forward with your heel resting on the floor, and keep your knee soft without locking. Maintain a completely straight spine. Place your hands on your hips and hinge forward slightly from your hip joints until you feel a gentle, warming stretch behind your knee. Hold this relaxing decompression stretch for 10 full seconds while taking deep, rhythmic abdominal breaths, allowing vascular smooth muscles behind your knee to dilate. Inhale calmly as you return to an upright posture. Take a short breath and repeat for 5 deliberate repetitions before switching to your left leg. This specialized decompression eliminates arterial entrapment, allowing a warm surge of oxygenated blood to flow through your popliteal space directly into your foot capillary beds. The fourth surgical grade circulation exercise is the seated soleus isopress with nitric oxide surge, engineered to activate your deep soleus muscle pump. The soleus muscle contains a high concentration of specialized venous sinuses that act as an internal biological reservoir, storing deoxygenated blood in your lower legs. Sit upright with your feet flat on the floor. Lift both heels off the ground as high as possible while keeping your toes firmly planted, and squeeze your calf muscles intensely. At peak heel elevation, hold this isometric contraction for 3 full seconds, feeling the deep soleus muscle compress internal venous sinuses and launch blood upward. Lower your heels slowly to the floor over a controlled 2-second phase. Take a calm breath and complete 12 controlled repetitions. This powerful isometric press triggers shear stress along vascular endothelial walls, stimulating the rapid biological synthesis of nitric oxide gas to widen your leg arteries. The fifth and final fast fix exercise is the seated leg tapping and vibration flush, designed to stimulate peripheral nerve endings and microvascular capillary beds. Sit comfortably in your chair, lift your right leg slightly, and perform fast, gentle heel taps against the floor for 20 seconds in a rhythmic, vibrating motion. These light mechanical vibrations stimulate cutaneous mechanoreceptors, relaxing microvascular sphincters and driving capillary blood flow to the surface of your skin. By practicing these 5 fast fix exercises daily, you maintain continuous vascular flow, eliminate painful nocturnal calf cramping, and keep your feet warm and vibrant. Let us now explore the essential anti-inflammatory nutrition strategies, hydration protocols, and daily vascular habits that preserve healthy blood vessels long past 60. The first critical mistake that accelerates poor leg circulation in aging adults is sitting for long stretches with your legs crossed at the knees or ankles. Crossing your legs creates direct mechanical compression on the popliteal and saphenous veins, increasing localized venous pressure and physically blocking deoxygenated blood from returning to your heart. Always keep both feet resting flat on the floor at a 90-degree angle while seated, allowing your blood vessels to maintain an unobstructed pathway for fluid movement. The second major error is wearing overly tight socks with restrictive elastic bands around your upper calves or ankles throughout the day. Tight elastic bands act like biological tourniquets, constricting superficial microcapillaries, trapping fluid in your feet, and causing painful skin indentations and ankle swelling. Choose loose-fitting, non-binding cotton socks or clinical compression socks that provide gentle, graduated pressure that decreases as it moves up your leg. The third critical mistake is taking extremely hot baths or heating pad treatments when your lower legs feel cold, under the false assumption that external heat fixes poor arterial flow. Excessive external heat causes superficial blood vessels to dilate rapidly, while deep arterial blockages remain narrow, leading to blood pooling, severe tissue inflammation, and swelling. Utilize gentle muscle contractions through seated exercises to generate internal physiological heat and drive natural arterial blood flow into cold feet. The fourth major error is neglecting daily hydration, failing to realize that blood viscosity directly dictates how easily your heart can pump fluid through narrow microcapillaries. Chronic low-grade dehydration thickens your blood plasma, forcing your cardiovascular system to work significantly harder to push stagnant blood through stiff, aging blood vessels. Sip fresh water consistently throughout your morning and afternoon to keep your blood plasma fluid, lower vascular resistance, and maintain optimal blood flow. The fifth critical mistake is ignoring early skin changes on your lower legs, such as shiny hairless skin, dark discoloration, or dry flaking patches around your ankles. These subtle skin symptoms indicate severe microvascular hypoxia, meaning your skin cells are starved of oxygen and essential nutrients required for cellular maintenance. By implementing our 5 fast fix circulation exercises daily, you flood starving skin tissues with oxygenated blood, promoting tissue healing and preventing venous ulcers. Eliminating these 5 harmful habits immediately removes the constant mechanical obstacles and biological stress that impair your peripheral circulation every single day. Replacing vascular constriction with targeted calf muscle pumps restores vibrant microvascular flow, keeping your legs light, warm, and pain-free. Let us now transition into integrating these clinical vascular insights into a seamless, highly effective daily morning protocol tailored specifically for seniors. This simple daily routine ensures you achieve optimal muscle pump activation, nitric oxide release, and fluid drainage in under 10 minutes a day. With consistent daily practice, you can look forward to years of confident, pain-free mobility without ever worrying about cold feet, swelling, or leg heaviness. Welcome to the fifth and final phase, your daily 5-step clinical vascular blueprint for ultimate leg circulation, fluid drainage, and lifelong mobility. In clinical vascular medicine, consistent daily mechanical muscle pumping is exponentially more effective than sporadic high-intensity exertion for maintaining microvascular flow and endothelial health. Begin every single morning immediately upon waking by drinking a tall glass of fresh water to hydrate your blood plasma and lower vascular resistance throughout your body. While seated comfortably in your morning chair, perform 30 seconds of the seated calf pump elevation with toe pointing, rhythmically flexing your ankles to flush stagnant blood from your lower leg veins. Follow immediately with the seated ankle alphabet, drawing letters A through Z with your big toe to activate deep peroneal muscles and stimulate microvascular capillary beds. Next, execute 5 repetitions of the seated popliteal artery decompression stretch per leg, hinging forward with a straight spine to release arterial compression behind your knees. Transition smoothly to the seated soleus isopress, lifting your heels high for 12 controlled repetitions to contract internal venous sinuses and trigger endothelial nitric oxide release. Conclude your morning routine with 20 seconds of the seated leg tapping and vibration flush, vibrating your heels lightly against the floor to relax cutaneous vascular sphincters. This complete fast-fix circulation protocol takes under 8 minutes each morning, establishing a continuous surge of oxygenated arterial blood and efficient venous return for your day. Whenever you sit for extended periods throughout the day, maintain conscious mindfulness over your leg alignment, keeping both feet flat on the floor without crossing your knees or ankles. Set a gentle hourly reminder to perform 10 quick heel raises or ankle pumps to prevent blood from pooling in your lower extremities during reading or relaxation. In the evening, support your vascular health by elevating your legs slightly on a footrest or cushion while unwinding, allowing gravity to assist venous blood return. Within the first 10 days of practicing this daily vascular routine, you will feel a distinct reduction in evening ankle swelling, leg heaviness, and cold toes. Between days 11 and 20, as endothelial nitric oxide production improves arterial dilation, nocturnal calf cramping will dissipate, allowing for deep, uninterrupted sleep. By day 30, restored microvascular circulation and healthy tissue oxygenation will empower you to walk, stand, and enjoy an active lifestyle with warm, light, and energized legs. Always remember that vascular maintenance is a lifelong biological journey that rewards consistent daily care rather than sudden physical strain. Listen attentively to your body's subtle signals, honor your daily progress, and take deep pride in every step you take toward preserving your vascular health and physical independence. Sharing this surgeon-backed circulation routine with your loved ones will empower everyone around you to reclaim their active, pain-free mobility and healthy leg circulation. You now possess the exact vascular biomechanics, the 30-second diagnostic test, 5 fast-fix exercises, and the daily blueprint required to keep your leg circulation vibrant long past 60. Take charge of your lower extremity health today. Activate your internal calf muscle pumps and give your legs the rich blood flow, warmth, and vitality they truly deserve. This is Dr. Robbert, wishing you vibrant physical health, resilient blood vessels, and a steady, confident stride every single day of your life.